We have in the studio with us Dr. Olufisayo Balogun. He's a consultant obstetrician gynecologist from Reddington Specialist Hospital. Please make welcome Dr. Balogun. Thank you for coming, sir.
Thank you very much.
So much. Alongside Dr. Balogun, we have a beautiful lady in the house, Mrs. Tilewa Ibirogba. She's the Director for Citizens' Rights, Lagos State Ministry of Justice, representing the Attorney General of Lagos State. Please, a round of applause for Mrs. Tilewa. Thank you for coming, ma'am. Thank you so much. And of course, we still have a practitioner and a medical director from Turkey Medical Center. Welcome with me, Dr. Yemi Ajao. You're so much welcome, sir. Thank you so much.
Thank you.
We're going to a commercial break, and we stay here on Healthwise. Please stay tuned. Thank you. Welcome back. And I'm still here with my wonderful guest. Now, I have a very vital question for Dr. Balogun. What exactly is abortion? How best can you define an abortion?
Yes, thank you, Chokwe. Simply defining abortion. Abortion is defined as termination of a pregnancy, either spontaneously or voluntarily, before the age of fetal viability.
Okay.
I'm going to break this down.
Please do.
Yes. Yes, the age of fetal viability differ between regions of the world. Here in Nigeria, it's accepted as 28 weeks of pregnancy.
Okay.
This is about 6.5 months pregnancy, and that's when it's accepted in our region, as the fetus is viable. This means should the fetus be delivered, the chances of survival is very, very high. In other regions of the world, especially in the developed world, the age of fetal viability is much less than the 28 weeks. In the United Kingdom, it's around 22 weeks, and the United States, 24 weeks.
Wow. Okay.
Yes, for the purpose of the discussion today, I know the medically abortion is quite wide.
Okay.
So, but for the purpose of the discussion today, I know we need to focus on the induced voluntary abortions.
Okay.
This is which is defined as when an individual, a lady or a woman, goes to seek assistance for termination of pregnancy before the age of fetal viability, 28 weeks, in our country.
Okay. Is Dr. Ajao willing to add one or two things to what Dr. Balogun just said?
Yes, that's exactly the definition of abortion.
Okay.
But there is another group of abortion where there is really no expulsion or extraction of fetus from or embryo from the womb.
Okay.
But there is no more viability, or the embryo is already dead inside.
Okay.
We call that one a missed abortion or missed miscarriage.
Now let's talk about the risk involved. What are the risks?
The risk involved in regions where abortions are legal, and it is done by competent practitioners and within the local laws in the environment. Induction of abortion is one of the safest medical procedures. But in this environment, in environments where abortions are not legal, you discover that people procure abortions illegally, and most of the time they don't go to qualified practitioners. So in that case, the risk is still very high. And abortions, we must say at this juncture that abortion, the risk involved, about 70,000 maternal deaths result from abortion globally, yearly.
Wow.
And illegal abortion also is responsible for about 5 million hospital admissions globally. Now, the risk involved, talking about the complications of abortion. Now, this can be divided, can be categorized into two broad groups.
Okay.
We have complications resulting from anesthetic agents, from anesthesia, and complications from abortion proper, induction of abortion proper. Now, from anesthesia, the complication from anesthesia can be dose dependent, can be as a result of the quantity of drugs administered to the patient when you give abortion. And it can also be idiosyncratic, Dr. Balogun. By idiosyncrasy, we mean that even a single drop of the anesthetic agent, the patient can react to it, and the patient can have cardiac arrest on the table. Wow. That is when you are doing it surgically, because you have medical and surgical abortions. Now, if it is, we are looking at the complications of abortion proper, this can be categorized into two broad groups.
Yeah, but Dr. Get more light on the risks. I want the lawyer to say something. Well, because you mentioned something about legal abortion. Is abortion in our country really legalized? Because we need to educate people at home. What are from legal angle, what do you have to say about abortion, please?
Legally in Nigeria, abortions are illegal in Nigeria.
Okay.
Simplicity.
Okay.
They're illegal. And I think the reason why they're still illegal, why we still have abortion as being illegal on our statutes, is informed very much by our moral values, our religious beliefs.
Okay.
We tend to see a life as existing from the point of conception. So we now remove a fetus, an unborn child, then that is deemed to be murder.
It becomes a sin.
It becomes a sin, yes. In other countries where they have legalized abortion, a major reason why they have done that is that they believe that life is not created from the point of conception. So when an abortion is gone, so they're not doing away with a life.
Okay.
To them. That's the way they see it.
Okay.
But we see a life as having been created at that point in time.
So would you say it should be legalized? So what's your take on this? Should we legalize the abortion?
I think to keep our youth safe, and I think we should remain the way we are. We don't have to follow the Western world in everything we do. It has its advantages, it has its disadvantages. So I think we should just leave our statutes the way they are.
Okay, fine. So let's talk more on the risks.
Now, talking about complications, complications can be divided into two broad groups. We have immediate complications.
Okay.
And then we have long-term complications.
Okay.
Immediate complications, we also depend on the method you are using. Some people use, when you are using drugs to procure abortion, the drug, when it starts the process, and it depends on the age. When you are using drug to procure abortions, there may be a very strong contraction, uterine contractions, and can result in the rupture. But the first complication that one will consider is bleeding.
Okay.
On the table, apart from the anesthesia.
Okay, those are the
bleeding,
signs you see?
Yes, when you are procuring the abortion. Okay. The bleeding may be hemorrhage.
Okay.
The bleeding may be so bad. The bleeding can result from when they are trying to gain access to the womb. The cervix can lacerate, or the womb itself can perforate the procedure. You can perforate the womb during the procedure. And then the products may not completely be evacuated.
Okay. And
then this will result into a lot of bleeding.
Okay.
So we have hemorrhage, which can result from perforation, laceration of the womb, and incomplete evacuation. Now, when you have perforation, there can be spillage of the content into the pelvis. Okay. So this one will result into, can be secondarily infected, and then there will be pelvic inflammatory disease. Okay. And that will be an acute, in the acute phase, pelvic inflammatory disease will be the symptoms that people will see as a result of that will be fever, lower abdominal pain, okay. Fever, and abdominal swelling sometimes if it is so bad. Okay. Now, the acute phase, if it is not well tackled, can now become chronic. And then people suffer from chronic lower abdominal pain, and then they have sexual dysfunction, especially when they meet with their husband, there will be pain and all sort of, and there is a lifelong
so that's the long-term effect.
problem. And in this environment, you discover that infection of the tubes can result, and that is actually the commonest cause of infertility, secondary infertility in this environment.
Okay.
So the tubes can get blocked because of infection of the tubes and the chronic inflammatory process.